How much do Botox injections for OAB cost? If you're curious about how much Botox treatments for overactive bladder might cost, you're not alone. Many people wonder about the expenses involved in managing this condition effectively. On average, Botox injections for overactive bladder cost between about $1,200 and $1,500 per session. This range can vary depending on where you live, the healthcare provider you see, and your insurance coverage. The typical dose used for overactive bladder is 100 units of Botox. The medication itself usually costs between $10 and $25 per unit. Since the treatment uses around 100 units, the Botox medication cost alone can be roughly $1,000 to $2,500. Besides the medication, there are additional costs for the procedure. The injection is done using a cystoscope, which guides the doctor to inject Botox into the bladder muscle. The fee for this procedure can differ based on the clinic and region. Many insurance plans, including Medicare and private insurance, often cover Botox for overactive bladder. This coverage can significantly lower out-of-pocket costs. For insured patients, the amount they pay might be around $1.50 per day if the total cost is spread over 6 months, which is the typical interval between treatments. However, coverage and copay amounts can vary, so it's important to check with your insurance provider. For those without insurance or with limited coverage, there are manufacturer savings programs that might help. These programs can sometimes cover up to $500 per treatment, reducing the financial burden. It's important to note that these programs usually do not apply to people on government-funded insurance like Medicaid or Medicare. In summary, the total cost for Botox injections for overactive bladder generally falls between $1,200 and $1,500 per session. Insurance and assistance programs can make this treatment more affordable. Always talk with your healthcare provider and insurance company to get a clear picture of what your specific costs will be. Remember, this treatment is a standard and effective option for managing overactive bladder, and personalized medical advice is essential to determine the best approach for you.